up. Today's Friday, December 10th.
Good company today. Good company today.
So I knew what it felt like. Stay with us. We'll be back with more of Good Company. We're going to tell you about a special place that you can go for wounds that will not heal. And comedian.
Spurred by an aging population and chronic disease, the need for special treatment and non-healing wounds has grown as well. Joining me this morning to talk about the Robinson Wound Care Center that just opened in Streetsboro is wound care specialist Dr. Amy Swegan. Thank you so much, doctor, for coming on the show.
Great to be here.
What exactly is the wound center and what do you do?
Well, the wound center is a place where we treat non-healing wounds. There are lots of different types of wounds that we treat.
So what is considered a non-healing wound?
A non-healing wound is any wound that hasn't healed in the time frame that it should. Most wounds should be healed within 3 or 4 weeks.
Oh, 3 or 4, okay. And after, what, 4 weeks, if you're not seeing it heal, then you obviously, have to...
That's a patient that should come and see us.
Now, is it all kinds of wounds? Are there even like small wounds that somebody might not even think that, okay, it's no big deal, but it could end up turning into a pretty big deal?
Sometimes it's a little bit like the iceberg where the tip looks small and what's underneath is huge. If it hasn't healed, somebody should probably be taking a look at it.
So whoever might need the wound care center is just one that after a 3 or 4 week period and it's not, okay. Well, can you share an example of a patient that actually was treated in your center?
Absolutely. We treat a lot of diabetic wounds. We had a patient, she was in her bedroom over the summer and just hit her leg on her bedpost, and this is one of those small wounds. But it didn't heal all summer. She was diabetic, so it was less likely to heal. So she came into us in the fall at the Wound Care Center, and in about 3 or 4 weeks with the specialized treatments that we have to offer, we were able to get that wound to heal for her.
Now, is it just for diabetics? Is it just, it could be a wide variety of things that why this wound isn't actually healing in the time that it's supposed to?
We treat a wide variety of wounds. Diabetic foot wounds are very common. We also treat venous stasis ulcers. These are people that have poor circulation in the legs and they get swelling and wounds that don't heal. Surgical wounds that haven't healed. We also treat things like bed sores.
And a lot of people get those if they're in the bed for a long period of time. If they're not moved properly, that does happen a lot.
Right. We do simple things like make sure that patients have an appropriate mattress or an appropriate cushion for their chairs.
So let's talk about your services. I'm sure you offer a lot, but when a patient comes in or if a family comes in, they really want to know what services you provide. What would you consider the top services that you provide?
Well, we have a whole sort of specialized dressings, boots, wraps. We place wound vacs. Those are a special vacuum that actually draws excess fluid out of a wound so that it can heal properly. We debride wounds, cut off any extra callus or dead tissue. And we also have something that's very unique to the Robinson Wound Care Center. We have a hyperbaric oxygen chamber.
Yeah, explain what that is. I mean, is that something that like Michael Jackson went to sleep in?
No.
I mean, it's a serious question, kind of.
Sort of.
Yeah.
Hyperbaric oxygen chamber is a big, clear tube that the patient lays inside of, and we fill it with high pressure oxygen. Oxygen at high pressure dissolves more easily in the blood, and then of course the blood supply goes down to the wound, and more oxygen in the wound promotes healing.
Now, and this is probably, it differs from patient to patient, but I would say on average, when you treat a specific wound, if it's nothing really major, how often or how long does it take for that heal to wound? Like if you went into that chamber?
It's a serious time commitment. A typical patient comes in 5 times a week, and a typical treatment takes about 2 hours.
Oh.
So while they're in the tube, in the chamber, we have a TV for them to watch. We have a telephone.
On Channel 3 at 10 a.m., right?
Absolutely.
Ah, good answer.
They do have a television. They can talk to our technologist, so we know when Good Company is on.
All right, great. Well, Dr. Swegan, thank you so much for coming on the show. Great. If you need this wound care center, it's in Streetsboro. Give them a call, 330-422-7755, or go to robinsonmemorial.org/wound care. All right, well, coming up on Good Company today, our ATL dog.